Hi, nakamute ka.
Good morning, everybody. So we
Morning.
are back. Gretchen
Mhm.
and I are here to discuss about thyroid and melatonin. So these two hormones are usually not given so much attention, and I don't think a lot of us, especially women, know about the influence of the thyroid hormone and also our melatonin. Maybe melatonin, yeah, because it's very common. There are many supplements there that we can take. Thyroid, it's a lot of women are underdiagnosed with this one. It is kind of complicated hormone to be diagnosed that we have a thyroid problem. So that's why I think it is very important for us to also simplify discussion about this one so we are aware.
Yep. So thyroid hormone is part of the endocrine system, isn't it? So it's just one of the hormones that's in the body, but it also affects different symptoms, especially in women, because it affects like 5 to 8 women in compared to men. That's
Hmm.
why we're tackling this one.
Yeah. And I'm not sure when you go to your doctor, OBGYN check, usually they'll feel your thyroid. And I did not really know why they would have to do that before, but now I can understand why. Because if we have, swelling there, then it could possibly tell something. And sometimes it doesn't really need to have like a visible um, like a swelling or something, but
Mhm.
that doesn't mean we don't have anything. It's always through blood tests where the thyroid problem can be determined. So
Yep.
thyroid hormone is considered to be a go 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 hormone, so it is responsible for us to feel energetic and upbeat. And
Mhm.
this is produced in our thyroid gland, and there are two types of thyroid, just T3 and T4.
Hormones.
It's
Mhm.
a mouthful to really say what the T3 stands for, but we do have a video that would explain that better,
Mhm.
regarding this influence of T3 and T4 in our system. And you might also want to ask about I know there's, I'm not sure if you have heard about it, but there is also what we call the thyroid stimulating hormone. But this hormone is not being produced in our thyroid gland. Instead, this is produced in our pituitary gland. So that is different.
Brain. Mhm.
Mhm. And so the T3 is responsible in regulating our metabolism. So sometimes we may feel that, we're like a yo yo, it's hard to maintain our weight. So thyroid plays a very important role in maintaining our weight, and also bone maintenance. It's also responsible for that, brain
Mhm.
development, and also during our menstrual cycle, it also plays a very important role. So,
Mhm.
in order to summarize this thyroid hormone, I do have a video that I would like to share because this doctor says it all. So, when I researched this one, um, I thought it is really a good, a good source for everybody to know and understand about our thyroid hormone. So, I am going to share it now. Common causes of thyroid malfunctions are autoimmune disorders, which means instead of your immune cells protecting your thyroid tissue, they attack it and interfere with hormone production. Access Health caught up with Dr. Mark Lugo, director of the Thyroid and Endocrine Center of Florida, to learn more about these often underdiagnosed conditions. Because the thyroid has an impact on every part of our body, sometimes the symptoms can be vague and difficult to make a diagnosis.
stimulating hormone. That's a hormone that comes from the pituitary, which is the master gland in the brain that communicates with hormone-producing glands such as the thyroid. So that TSH gives us great insight into the thyroid balance status of the body. So if the TSH is normal, then generally that patient has normal thyroid function. If the TSH is abnormal, then we look at the actual thyroid hormones that the thyroid's producing. So that's T4, which is the predominant hormone that's produced by the thyroid that gets converted into T3, which is the more active thyroid hormone. So those are your options for what else can I test hormone-wise to see how severe either the overactivity or the underactivity might be. There's been some debate on what the reference range should be. So in a lab report, you'll have a result, and then there'll be a range that your doctor looks at. But sometimes that individual result might be at the lower end of the range or the higher end of the range. Even though it may not be flagged as abnormal, I begin to ask more questions. Do you have a family history of thyroid problems? Do you have any thyroid symptoms? Do you have any thyroid enlargement? Have you had a miscarriage? Are you trying for pregnancy? All these things that trigger the need to explore more. The problem is the underlying autoimmune disease, and that can exist even if the TSH is normal. So we need to look deeper into options for testing and identifying those patients who may be at risk for autoimmune thyroid disease and not know it. Autoimmune thyroid disease is the most common thyroid problem we see. Graves' disease is the most common reason people have an overactive thyroid, and that's when the immune system attacks the thyroid and tricks it into making too much thyroid hormone. Whereas Hashimoto's is the most common cause of an underactive or hypothyroidism. So the immune system attacks the thyroid and destroys the normal thyroid gland, and patients then have underactive thyroid. When the thyroid's underactive or slow, people have brain fog, they have depression sometimes, fatigue, exercise intolerance, feelings of shortness of breath. They'll retain some fluid and gain a little bit of weight. Become constipated, get cold easily, have dry skin, and sometimes hair thinning. On the other end of the spectrum, the immune system tricks the thyroid or stimulates it into making too much thyroid hormone. Everything is sped up. So people have anxiety, insomnia, they get fidgety, they're shaky, they have heart palpitations, again, exercise intolerance, feelings of inefficient breathing or shortness of breath, muscle weakness, sweating, and weight loss because the metabolism is revved up. So patients individually can have both attacks at the same time. So that's why we think of it as a spectrum and not as either or, but all those symptoms are not specific to thyroid. So in diagnosing a thyroid problem, we have to look at the whole picture: family history, physical exam, the patient's symptoms, other medications they might be on, because sometimes it's not as straightforward as it would seem, and it needs a very thorough, because autoimmune thyroid disease is what is causing the thyroid function problem. We have to look at what the immune system is doing. So we have to look beyond those basic tests.
According to the guidelines published by the American Thyroid Association, measurement of thyroid antibodies for confirmatory diagnosis of autoimmune thyroid disease is recommended.
There are different types of thyroid antibodies in the blood. Some of them will stimulate the thyroid to make excess thyroid hormone, and we see that in Graves' disease. Some of them will block the thyroid and decrease the thyroid hormone production, causing hypothyroidism. Some of them will destroy or damage the thyroid, and those are the thyroperoxidase and thyroglobulin antibodies that we see typically in Hashimoto's. There are times where the TSH test is normal, but the thyroid is already under attack by the immune system. So the times we think about that would be if there's a strong family history, if there's some symptoms suggestive of thyroid, or previous history of thyroid TSH results that fluctuate a little bit. Very importantly, if there's a young woman who has had trouble becoming pregnant or who has had miscarriages, screening with a TSH is not enough. Looking at thyroid antibodies is very important to explain those reproductive problems, which are quite treatable with thyroid medication. Other times we see patients with thyroid eye disease. So the eyes become bulging, the vision becomes impaired, the eyes can ache or be irritated, seemingly maybe eye allergies or something else, but that can be Graves' disease, where those antibodies that attack the thyroid, the TSH receptor antibodies, also attack the fat and muscle behind the eye and cause the bulging. And that can occur with the normal thing. They might have a thyroid problem, and simply talk to your doctor. Call the office, make an appointment, explain what symptoms you're having and ask whether or not thyroid testing would be appropriate.
Yeah, so see, there we go. It is really hard to just simply diagnose the if we have any problem with the thyroid. So I think it is very important to know what are the symptoms that we have so we can tell our doctor. Because if we go there and then we don't tell them anything, then it is really hard for them to get started as to where and how they can help us. So identifying those symptoms, especially under Hashimoto's and then the Graves' disease, it is very important, so at least they can have some ideas. Otherwise it is really hard for to get them started. And as much as they want to help us, if we're not also helping them by telling them our symptoms, then it is really hard in general.
Yeah. So maybe they want to know what are the typical symptoms of like when we say hyperthyroidism, that means there's increased secretion of the thyroid hormones in the body. And when you say hypo, because hypo is low, that means hypothyroidism, that means low thyroid hormones in the body. Because sometimes the doctors would say, when patients would say like, oh, I've got depression, I've got fatigue, I have sleep disturbances, and what doctors would do is just address those symptoms. But if you tell them collectively your symptoms, then they might be able to know, oh, maybe it's a thyroid problem. And they can investigate further and do blood tests and do things. So for hyperthyroidism, the typical symptoms is like weight loss. I've seen hyperthyroidism people, and these are really very significant symptoms that you can see with them. So weight loss, and then they will also have like fast heart rate, high irritability or nervousness. They have muscle weakness and tremors, and frequent menstrual periods is why it affects also the female reproductive system, sleep problems, eye irritation, and heat sensitivity. So that's some symptoms of hyperthyroidism, and sometimes like enlargement of the eye. So for hypothyroidism, which is the low thyroids in the body, it's contrary to the hyperthyroidism symptoms. So this patients will then have weight gain, they've got slower heart rate, they feel fatigued, and they've got more frequent or stronger menstrual periods. There's forgetfulness, dry skin and hair, hoarse voice, and intolerance to cold. So hyperthyroidism, heat sensitivity, while hypothyroidism, just intolerance. So in addition to that, they can the hypothyroidism can also be accompanied by goiter. Have you heard about goiter? The enlargement of the thyroid gland, because that means that your thyroid is overly overworking just to get the demand. But there's also loads of reasons for goiter, but those are just some symptoms when you talk about them.
Yeah, so if we have some symptoms, we cannot self-diagnose, obviously. So we have to go to our doctor and tell them about the symptoms. If we have like cold hands and feet, then it might be a sign. But not just that, we have to really check other areas that the symptoms of hyper and hypothyroidism, right? Yeah, and also it's also said that if we have low thyroid production, we also have low T3 production. So that means we also have lower progesterone production. So see how they are related with our menstrual cycle. So it is one of the hormones that is really important for us to know as well. Not just the estrogen and progesterone, these all hormones that we are discussing, they affect us entirely, and they talk to each other. So later on we're going to discuss the overall wrapping up all this hormones. So now we are going to proceed to melatonin, the sleep hormone.
Sleep hormones, indeed. Can I just add about the thyroid hormone?
Sure, go ahead.
It's very beneficial as well to have good iodine levels in the body. So back in the Philippines, that's why they said that those who commonly suffer from thyroid problems are like for those who lives like farther away from from the sea where they can get iodine source foods like seafoods and even like dairy products. Like even now we have iodized salt, so that can be a good source of iodine as well.
Mhm.
Yeah, that's it.
All right. So to open up for the melatonin, I am going to play another video, which is really an easy explanation of our friend melatonin.
View melatonin and all of its wonderful uses as we do test it on the Dutch Complete test. Melatonin is a hormone secreted by the pineal gland in the brain, and it helps regulate other hormones and maintains the body's circadian rhythm. The circadian rhythm is this internal 24-hour clock that plays a really important role when we fall asleep and when we wake up. Basically, when it's dark, your body produces more melatonin, and when you're exposed to light, the production of melatonin drops. I like to say that with cortisol is like the sun and melatonin is like the moon. Cortisol should be high through the day and melatonin should be high through night. If you're exposed to bright lights in the evening or too little light during the day, you may have abnormal levels of melatonin. Jet lag, shift workers, and poor vision can all be a real problem with melatonin cycles. The main hormone just before melatonin on the steroid pathway is serotonin, and it takes 2 different SNPs to make melatonin. If there is a problem with one of those SNPs, or with your serotonin levels, you may have a problem with your melatonin. Melatonin is a really important antioxidant and has a number of responsibilities besides just helping you sleep. For example, melatonin helps control the timing and release of your female reproductive hormones. Same for men. It helps determine when a woman starts to menstruate, the frequency and duration of her cycles, and when she stops menstruating or goes into menopause. If her circadian rhythm is off, she may notice that her menstrual cycle is off also. Preliminary evidence suggests it can really help strengthen the immune system. Of course, research is needed. Several studies have shown that melatonin may have cardioprotective properties because of its antioxidant and anti-inflammatory effects. For example, it may help lower blood pressure levels, and it might help improve cholesterol profiles. Melatonin is critical for making, secreting, and the action of insulin. Now, insulin is really important for blood sugar management. The action of melatonin regulates the expression of this particular transporter called a GLUT4, or glucose type 4, and this triggers phosphorylation of the insulin receptor. When you have a reduction in melatonin, you may get an increase in insulin resistance. The more insulin resistance you have, the more likely you are to go on to develop diabetes, and of course, excess weight gain, especially around the middle. Melatonin is really important for making sure this doesn't happen. It's often said that sleep is critical for healthy weight management, and this may be a reason why. Because of its antioxidant status, melatonin is also being researched in the oncology field, as it's known that those women with breast cancer often have lower melatonin levels, as do men with prostate cancer. Be aware that melatonin is also made 400 to 500 times more from the enterochromaffin cells in the gut than in the pineal gland. When you have gastrointestinal upset or distress, melatonin is made to act as an antioxidant and anti-inflammatory right in your GI tract. Now, common reasons for higher melatonin, and it could be that you just make higher levels of melatonin. Some people just have really robust levels. Be aware, though, that stress can also mildly raise melatonin. It's an antioxidant and it's anti-inflammatory. Supplementation. Those people taking melatonin will show high levels of melatonin on the Dutch test. The Dutch test is definitely used as a baseline, as we can't monitor melatonin supplementation with the results. Gut inflammation will raise melatonin again, as it is protective. Those people taking 5-HTP or SAMe or tryptophan supplements may have higher levels of melatonin because they're raising their serotonin. It's debated, but certain SSRIs that are used for depression may raise melatonin levels. The birth control pill has been shown to slightly raise melatonin, and certain foods are high in melatonin, such as cherries, walnuts, mustard, corn, rice, ginger, peanuts, barley, oats, asparagus, and tomatoes. Now, what can cause low melatonin or suppress melatonin? Well, of course, the number one thing is exposure to blue light at night. For those people that are on their phones and their computers and their tablets, consider cutting out those things about an hour before bedtime, or buy those blue light blocking glasses that have the orange frames so that you don't get an increase in cortisol and a suppression of melatonin right before bed. Caffeine will raise melatonin. Tobacco will raise melatonin. If you have mutations in those two genetic SNPs, one of them is known as the AANAT, and the other one is known as the ASMT. Those are the SNPs that move from serotonin to melatonin. If you have a problem there, then you won't be able to make melatonin genetically. Again, SSRIs, specifically Prozac or fluoxetine, is shown to suppress melatonin. Calcium channel blockers for blood pressure, such as verapamil or diltiazem, they can suppress melatonin. Beta blockers like atenolol, metoprolol, and propranolol. And NSAIDs, those of you who are taking aspirin or ibuprofen, Aleve, Motrin, Advil, especially later in the day when you're trying to go to bed, you may have decreased levels of melatonin as well. When you're looking at the Dutch.
There we go. Okay.
Yeah.
Yeah, so melatonin is considered to be a night hormone because it produces, we produce melatonin when it's dark time, and the cortisol is in the morning. So we have to remember again that if we have high cortisol, there is going to be an inhibition of the melatonin. And aside from that, the blue light, as being mentioned, like, because then if there is light, then the body will sense it that it is still daytime. So that's why it is very important for us. Sleep hygiene is very important for us.
Yep. And I think that goes well again with like stress management and all for that one.
And I know there are so many supplements about melatonin, you can take it, but there is nothing better than really taking care of ourselves, having a stress-free or lower the stress, and then at nighttime avoid having blue lights or iPads, phones, and that or TV in the bedroom. So it is very important and best for us if it's going to be totally dark, so the body can sense that it is nighttime and it is time for the body to produce the melatonin, and at the same time lower our cortisol. Otherwise it's going to be hard for us to sleep, and possibly that's why a lot of people have insomnia, because they couldn't sleep, and maybe so many things are going on in their minds. So dark room and nice music, it'll really help us produce the melatonin.
I've actually read here tips for improving sleep long term. So this is like a general tip as well. So it says go to bed and get up at a regular time. I know it's very difficult especially for like shift workers and all these people. So routine is very important for establishing a good sleep pattern. Establishing and sticking to set times may take a few weeks, so bear that in mind. Next is ideally avoid having a nap in the day. If you do, make it no more than 30 to 40 minutes in the early afternoon, or else you'll have difficulty sleeping at nighttime. And then it says also to exercise regularly, but don't overdo it within 2 hours of going to bed.
Yeah, that's really a good, good tip.
And
we have to also remember.
Sorry.
Yeah, we also have to remember that melatonin is responsible for our circadian rhythm. So that means from 9 to 5 or down. So I know it is hard, especially with visually impaired people, but I think they probably have some strategies on how they can, sleep. I'm talking about like blind, blind people. I'm sure they have their way. Probably they're going to just get the feel of themselves. Like probably they don't have problem that much with sleeping, but getting up and knowing, if it's
When, yeah.
daylight. Yeah, because if
For the more modern world, there's loads of things that can help them, like in that matter, there's loads of things that can assist them with their sleep routine as
yeah,
well.
actually, I started this week, instead of having, I will set the alarm to help me wake up, but I
Mhm.
can always snooze anytime. So
Like
I tried this lamp, and now they have this lamp where it'll resemble
bright
like
light.
sun or moon or something,
Mhm.
and I set it where it'll turn on at 5:30, and that really helps. It'll really
Yeah.
make me like wake
I was,
up.
yeah, I was actually thinking to get that, but then Graham can't sleep with the lights on, so I didn't help him. I'll I'll get him up as well. So yeah, I really want that because it's so hard to wake up if it's still dark. And I really find it easier that when there's light, you know, you'll be more awake in the morning.
Yeah. And I'm not sure, do you remember, like, growing up, we are always being pushed to wake up when the sun is up,
Mm-hmm,
right?
mm-hmm. Yep,
Um, hold
yeah. So somebody's there, right? And I'll probably just continue this one. So, they said the average sleeping time is like 6 to 8 hours, but this does vary for every individual, and it reduces as well as you age. There are other factors that interfere with sleep, including physical symptoms, other than those associated with menopausal. So in menopausal, there will really be a bit of hard, sleep disturbance because of all the symptoms that you're feeling. So if you're taking medications for other reasons, ensure that you take them at the time of the day that they are prescribed for. And when you uh, before you go to bed, get yourself into a routine. Perhaps have like a nice warm bath or do some light reading, anything that can relax you. And avoid going to bed when you're too hungry or too full. Light is okay. Have your last caffeine drink in the late afternoon or evening, including fizzy drinks or chocolate, because those are stimulants, so it will give you difficulty sleeping.
yeah.
Guys, the alcohol does not help you sleep, so best avoid if you can. But I'm opposite, so I'm
Me
not.
too. Actually, I would
I
feel
like
sleepy
after
at
a few
night.
days, I'm already like, yeah. So we'll get that one. Then environment, it says ensure your bedroom has a restful feel. Ideally, the room should be cool but not too cold, and screen out as much noise and light as it's practical for you. Get comfy and like good bedding and good mattress, and use your bedroom just for sleep. And
Yeah. So,
avoid watching TV in bed as well or using your laptop and your phone.
see, so we have to really continue having or practicing this sleep hygiene, because it is very important overall. It is very, very important to have good sleep, right?
Mhm.
All right. So we are finished with our discussion with the thyroid and the melatonin. We are gonna be back in maybe about 5 or 10 minutes. We're just gonna have a break, and we're going to wrap up all the hormones that we have discussed.
Mhm.
So next month, we're going to be doing another discussion, and it's gonna be about the period or the menstrual cycle.
Yep.
Okay.
Thank
All right.
you.
See you. Bye bye.